Bethesda Adult Clinical Services are providing crisis intervention training to Niagara Regional Police officers, better equipping them in dealing with those who have a developmental disability or mental health concerns. Here in the studio from Bethesda is Clinical Manager Leah Jeffrey. Leah, this is such important work. Why don't you just tell us, how did this come to be?
Yeah, absolutely. So Bethesda and Canadian Mental Health Association have actually had a partnership for a number of years. So we have a partnership through our adult clinical services with a behavior consultant who supports our the Canadian Mental Health Association's crisis bed. And so out of that partnership, we also recognize the need for our Niagara Regional Police to be trained specifically in the area of developmental disabilities. So individuals that have a developmental disability do have occurrences within the criminal justice system, and we recognize this gap of officers really needing to understand what an individual with a developmental disability, some of those common characteristics, and also some of the best strategies that they could be using to best support them in their interactions. And so Canadian Mental Health Association provides this crisis intervention training, which is a week-long training to officers, specifically in the area of mental health. And we recognize that one of the areas is training in developmental disabilities. And so we've partnered with them, and we provide a piece of the training within that 4-week period that is specifically to train officers on how to best support someone with a developmental disability.
Okay, well, that leads me perfectly into my next question, because how is this training delivered in a sensitive way?
Yeah, great question. So we have amazing clinicians who provide this training. So one, we have a dual diagnosis justice case manager. So her role within our adult clinical is to provide individuals that have a dual diagnosis, so developmental disability as well as mental health or challenging behavior. And so her role is really to best support people throughout the criminal justice system in a variety of different ways. And so she has some extensive experience in working with officers and police, and so she, along with one of our amazing mental health clinicians, also provides this training. And so they offer information around how to best to recognize an individual, so some of those common characteristics of someone with a developmental disability, but then also how to best communicate. So one of the challenges that many people with developmental disabilities have is communication. And so they really provide some excellent communication strategies so the officers can better communicate and have better outcomes.
And what has been the response from these officers that are going through the course?
Yeah, so there's been some really great responses. We've worked with officers for a number of years, and many of them recognized that they have had encounters with people and really just did not feel equipped. And so this information has been helpful, giving them not only an awareness, but an increased comfort level as well to have some of those interactions. And then also another really important aspect of it is they have resources or know who to go to when they have an encounter or when they are trying to support someone. We're able to provide some of those resources for them.
And really setting Bethesda as a leader in its field, that's for sure.
Yeah, definitely.
Now, where and when is this training taking place?
Yeah, so this training happens quarterly. So every 4 months, the training is, or every 3 months, the training is offered. And so we provide 1 hour of training in that 4-week period.
And what would you say Bethesda and the Canadian Mental Health Association is really hoping to see come out of this type of training?
Yeah, so the goal is really to equip officers to feel more confident, to have an increased awareness, but then also to be able to connect individuals to resources within their community. And so we've seen some of those positive outcomes happen as a result of this training. And so I think it's been incredibly valuable.
And how important is this type of education for the general public as well?
Yeah, I would suggest that it's incredibly important. People that have a developmental disability often are incredibly vulnerable to a number of different experiences. And so understanding best approaches, understanding resources that are available can be incredibly helpful.
Okay. Well, thank you so much for all the information and everything you guys are doing over at Bethesda, and we welcome you back anytime.
Thank you.